Every year, the experts at U.S. News & World Report rank the nation's best hospitals. They've recognized St. Vincent as the #1 hospital in Arkansas and listed 8 clinical areas as high-performing specialties. The next closest Arkansas hospital only had 3. This recognition is due to the unwavering commitment of our world-class physicians, dedicated nurses, and associates who have now made St. Vincent the state's #1 hospital.
Back talking with Dr. Morgan Sauer from the Longevity Center at St. Vincent's. We're talking today about food poisoning. Yes, something that you hope you never get, but probably may have gotten before. It happens to all of us eventually, unless you are super careful, and let's face it, you don't want to be like that. Dr. Sauer, great to see you.
Good morning to you.
I know this is a topic that probably gets brought up every now and then, and it's one that no one wants to face, but we have to eventually. So talk about some of the food items that maybe folks should watch out for, or types of foods when it comes to food poisoning.
Dairy products and mayonnaise are my big two, especially when they haven't been properly stored, because mayonnaise goes in a lot of things, a lot of coleslaws, a lot of potato salad. And what do? You go out for the picnic, you set them all out, and they stay there for hours and hours. You eat, you go back, eat a little more, and it's just been cooking, waiting for you to come by and eat it. Also, be careful with things like undercooked meats. Being sure that meat is prepared properly. So meat needs to be prepared on its own block with its own knives, own scissors. If you're going to open it, cut it open packages. And then everything else, especially if it's not going to be cooked, needs to be prepared in a separate area that's clean.
Yeah, when you talk about those meats too, cross-contaminating can go much deeper than just foodborne illness. It could go, I mean, the less likely version or less serious ones like we're talking about now, you could even salmonella and other types of bacteria that can be very serious, so you don't want to get those. There are some common items there on your screen, and when you talk about symptoms, you know, one thing that always comes to mind first is a queasy feeling in your stomach. But it can also be some other symptoms too that could be early indicators.
Abdominal cramping, pain, nausea with vomiting, and of course the one that everybody dreads, the diarrhea.
Yes, exactly. Don't want to get that.
It hits and it starts flowing, and it's really important because people want to run and they want to take something. I want to stop this to happen. No, you actually don't. If there's something in your stomach or in your intestines that you need out of you, your body knows it. So it needs to go ahead and come on out. So I do not recommend that people try and stop the diarrhea. Let this stuff flush out of your body, and be sure you add plenty of fluids or drinks like Gatorade that have a lot of electrolytes in it to help replace some of the elements and some of the minerals that you lose.
Would you suggest water and Gatorade, or just the Gatorade at that time, maybe to kind of get your system flowing a little bit more? Like you mentioned, the electrolytes, but is water something that...
Whatever you have available.
Okay.
Everyone's got water, so drink water, and then if you have access to some Gatorade or feel like you need it, that's fine too. But certainly water is the best of all. So
say your body is flushing it out as best it can. Talk about some treatment options that are available to folks out there if they feel or experience any of those symptoms.
Again, the fluids, Pedialyte, Gatorade can help with that. You can use, if you still have diarrhea after 3 days, then you probably do need to go ahead and use something. You even need to go and see your doctor. You may have something else that is happening that you need to be checked out for. Definitely trying to make sure that you stay hydrated is going to be the key.
Over-the-counter meds, are those available? I mean, you talked about things to stop some of those symptoms. Should you use those and then maybe go see a doctor, or should you call your doctor just in case, like you said, after 3 days? That is quite a long time to be experiencing that.
If you're starting to get dehydrated, like you try and stand up out of bed and you feel like you're going to pass out, or you can feel your heart rate go up and you're feeling wobbly. If you're getting dry, if you open your mouth and you look in on the mirror and you see that it's dry, or you pull your eyelids down and you see your eyelids are dry, you definitely need to get in to see your doctor. Sometimes once the nausea and the diarrhea get going, you actually need IV fluid replacement to make that stop.
So if someone looks at you and says, man, you look terrible, maybe consider
getting... That's usually a good sign to go to the doctor.
That's a sign right there. Okay, let's talk about some foods. You know, one thing that I've experienced, and I think a lot of people have too, after you get sick, A, I never want to eat that food that I ate that I know I got sick of ever again. And then B, I don't even know what to get back into food-wise to keep something down and keep it in my body. What are some good foods to maybe get back into?
All right, so what happens is the lining of the intestines gets damaged because of an inflammation reaction. So you want to get things that are very, very simple that your body can absorb really without the intestines having to work. Things like Jell-O. Juices, I recommend typically like an apple juice or a grape juice, something kind of soft. Sugars work well for about the first 48 hours. Then you can start adding things like crackers and breads, You definitely want to avoid meat and dairy for about 4 to 5 days.
Oh, really?
Meat and dairy is really complex. The intestines have to work diligently to bring that into the body. So don't stress the intestines out. They've got enough problems. Give it 4 or 5 days, then you can add meat and dairy back. And your body will guide you. When you start feeling hungry and feel the rumblings like I got to get something to eat, that's a good sign that you're probably going to be all right.
Listen to your body, folks. It's that simple. Also listen to the doctors, and you can always go to the Longevity Center at St. Vincent for more information. We do have that for you here on your screen, and we always enjoy when Dr. Sauer comes by to talk with us. Thank you so much, Dr. Sauer.
It's great to see you.
Great to see you.